Our next presenter is Dr. Barbara Walker. She recently joined the integrative medicine and executive health teams at UC Health. The focus of her practice is on health and performance psychology. She partners with clients and patients to achieve their optimal energy, health, and performance using a skill-based educational approach to mind-body medicine, using modalities such as biofeedback, relaxation training, mindfulness, solution-oriented cognitive behavioral strategies with the goal of self-regulation. Areas such as sleep, movement, exercise, eating behaviors are addressed. Dr. Walker will be talking about integrating mindful living, and we're looking forward to her presentation. Dr. Walker.
Good morning. I don't know if most of you have heard the term mindfulness at this point. I think you probably have, but sometimes it's difficult to know exactly what that means when it's being thrown around in the popular culture. And I know Dr. Golubic probably talked about that a little bit in his presentation. So I'm just going to go ahead and jump right into what mindfulness is and give a definition. And one of my favorite people who does mindfulness meditation is Jon Kabat-Zinn, and he really brought mindfulness into our current culture. Really in 1979, he started a program called Mindfulness-Based Stress Reduction and brought that into Massachusetts Hospital. And he's been creating this program, and a lot of people have followed and have been certified in the program. But in terms of his definition of mindfulness, I think it's a good one. So I'm going to read through this a little bit, very piece by piece, and then do a little bit of a deep dive into this. So mindfulness defined as paying attention in a particular way, on purpose, in the present moment, as non-judgmentally, non-reactively, and open-heartedly as possible. Wouldn't it be wonderful if most of us were like that most of the time? So when we think about mindfulness, we're thinking about observation without criticism, being compassionate with yourself, and it's deliberately paying attention to what's happening around you and within you and your body, your heart, your mind. So it's this awareness without, again, criticism or judgment. So think about how often you might be in that space. So when I pull it apart a little bit, when I look at paying attention in a particular way, so to be mindful, you really need to be paying attention, whatever you're choosing to attend to, and we'll talk about that and how you can apply that to daily living in a little bit. And then present moment is really around the reality of being in this present moment, in the here and now. And it means that you just need to be aware of the way things are as they are, not how you wish them to be. That's when we have, as we call it dukkha, when we're wishing something to be different than what it is. So trying to understand what that is in the present moment. And non-reactively, you understand that. It's all these judgments we have. We react to things, rather than responding to things either internally or externally. So a reaction is really automatic and gives us no choice, but a response is really deliberate and considered action. And then again, non-judgmental, trying to go through life a little bit more with ease, and same way with open-heartedness, just bringing a quality of kindness, compassion, warmth, and friendliness to your experience. So mindfulness background, it's been around for 2,500 years, so it didn't come, even though it came to our Western culture more recently in the last few decades, especially in the last decade, we've been hearing more and more about mindfulness, but it's been around for a long time. And it's really from an Eastern philosophy or Eastern meditative practice, but what I want you to know too, it's a complex process, and if you've ever practiced mindfulness, you know that. It's complex, but it's really this natural ability, and we'll walk through a couple exercises in just a moment. So the idea behind mindfulness is really around synergistically interacting behavioral, kind of affective, cognitive components. And what I want you to know too, it's not hypnosis, it's not really meant to be relaxation or distraction. It's not really meant to clear your mind. That's really impossible. And it's not religious or faith-based. There's so many different versions of meditation in so many of the world's traditions, but we're going to walk through an example in just a moment. So if you would, I'm going to take you through a practice here. And go ahead and get yourself in a comfortable position. And I'm going to combine a couple of things here. I want to do a mindful breath exercise with you, and then I want to talk about diaphragmatic breathing right at the end. So go ahead and start by settling yourself into a comfortable position and allow your eyes to close or just keep them at a softened gaze so you can just pay attention to what's going on for you. And then begin by taking a few deep breaths. Slow breaths, in fully and exhaling fully. And breathing in through your nose if that's available to you, and out through your nose if you can, or through your mouth. And just allow your breath to find its own natural rhythm. And bringing your full attention to noticing each in-breath as it enters your nostrils, travels down to your lungs, and maybe even causes your belly to expand. And then notice each out-breath as your belly contracts and air moves up through the lungs, back up through your nostrils or mouth. And just sit here for a moment, inviting your full attention to flow with your breath. Maybe notice how the inhale is different than the exhale. You may experience the air as cool as it enters your nose and warm on the exhale. And as you turn more deeply inward, just begin to let go of any noises or sounds around you. If you're distracted by sounds in the room, just simply notice them and bring your attention back to your breath. And simply breathe as you breathe, not striving to change anything about your breath, not trying to control your breath in any way, observing and accepting your experience in this moment without judgment, paying attention to each inhale and exhale. And if your mind wanders to thoughts, plans, or problems, simply notice your mind wandering and watch the thought as it enters your awareness as neutrally as possible. And then practice letting go of the thought as if it were a leaf floating down a stream, or even allowing your thoughts to go up into a cloud and watching that cloud dissipate. And bring your attention back to your breath, allowing your breath to be an anchor that you can return to over and over again when you become distracted by thoughts. And just notice when your mind has wandered, maybe even observing the types of thoughts that are hooking or distracting you. Noticing is really the richest part of this learning. With this knowledge, you can strengthen your ability to detach from thoughts and mindfully focus your awareness back on the qualities of your breath. And practicing coming home to the breath with your full attention. Again, maybe watching the gentle rise of your stomach on the in-breath and the relaxing letting go of the out-breath. And allowing yourself to be completely with your breath as it flows in and out. You might become distracted by pain or discomfort or twitching or itching. But draw your attention away from your breath and remember that's very usual, very normal. You may also notice feelings arising, perhaps sadness or happiness, frustration, contentment. Acknowledge whatever comes up including thoughts or stories about your experience. Simply noticing where your mind went without judging it, pushing it away, clinging to it, or wishing it were different. And simply refocus your mind and guide your attention back to your breath. Just a few more moments here, breathing in and breathing out, following that air all the way in and all the way out. Just mindfully being present moment by moment with your breath. And just stay here for just a moment and pay attention to how your body feels overall, what you're thinking about. If you're able to bring yourself back, do you feel a little different than you did when you started? And before you open your eyes, I want to just walk through a little bit of a diaphragmatic breath with you. You've already been doing this breath in and out. And when we talk about belly breath, what we want to do, I don't want you to overthink it, but allowing yourself as you're breathing in, it's a little different than a normal breath, but allow your belly to just rise with your chest. And then as you exhale, just feel your belly contracting. And we'll just do this for another minute or so. And you can feel, if you want to put your hand on your belly or your hand on your heart, just to feel that belly rising. We've been so trained to contract our muscles all the time in our belly, kind of holding that in. And I'll talk about the science with that in just a moment, but allowing yourself just to stay with that breath. You can even find a count that might work for you to keep you focused. It could be 1, 2, 3, 4, 5 in, and 1, 2, 3, 4, 5 out. Making it even from your inhale to your exhale. Some of my patients even put some words into their breath, so you could say peace on your in-breath, relax on the out-breath, just to allow yourself to stay focused on this. And remember that the breath is always with you as a refocusing tool to bring you back to the present moment. And whenever you are ready, you can open your eyes. Hopefully everyone is still awake. Good. Good. Dr. G's doing a little stretch. It's good. Yeah, stretch yourself around so you can stay awake and listen. Good. So that's mindfulness, and it generally starts with the breath. What I love about the breath is it's free and portable, right? We have it with us all the time. And when we were born, we used to breathe with this diaphragmatic breathing pattern. And just from life stress and life activities, we end up letting go of that. So practicing that and coming back to that, and we'll apply that to how that could look on a daily basis for you. So when we're talking about breathing deep into the belly, the other piece from the science part is it's affecting your autonomic nervous system, which is your fight or flight system that we have. And so allowing yourself to breathe deeply into your belly allows you to affect your vagal nerve, which is part of what's called your parasympathetic system. It's probably too much information, but the idea of really being able to, this is mind body at its finest, being able to calm that down. And then giving yourself this nice larger breath than normal. What ends up happening is whenever we get a negative or an anxious thought in our head, we start contracting muscle fibers and we start breathing really shallowly. So really focusing on a little bit bigger breath than your normal breath, not so big that you feel lightheaded if that happens, back off a notch, but the idea of really focusing on this breath is sort of the first key to being able to manage the stress. So I can't talk about mindfulness without talking about stress and perceived stress, because we know that there's a lot of stress always, it seems, in our culture at the moment. And I'm sure with dealing with some of the symptoms that you have, sometimes you can attest to that. So just in terms of the definition of stress, it's a non-specific response to a demanding or threatening event. It's a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. And I put the word perceive there purposely because what happens a lot of times is we are perceiving some stress that might not be a true stressor. But when we react as if it is a stressor, our body goes into this fight or flight mode. So generally, perceived stress, it's being too routine or getting caught up sometimes with our thoughts and the future or past, it gets us in the way of that present moment awareness that we're trying to have for meditation or for mindfulness. So it is everywhere, stress. It's not going to go away. And there's a time and place, obviously, for reacting. But when we stay in that stress place, and we're going to talk about some studies in a second, but it keeps us in what I call this cave person mode. So it keeps us in this place where we're overreacting, we're misperceiving potential threats, we feel irritable, we stay on survival mode, or we feel ready to pounce. So maybe some of you can identify what that feels like in your body. So this graph here is really about that idea, what I talked about before with the autonomic nervous system. So this all starts in our hypothalamus. It's a thought that we have that starts this whole ball rolling. About 20 different things happen physiologically in our body when we start reacting to stressors. So what we want to make sure we do is implement coping techniques, building resiliency and integrating mindfulness into your daily routine. That's going to help you reduce that stress response and allow you to be a little bit more mindful. So a couple studies I'm going to go through really quickly. This one looked at stress and mindfulness, and looking at patients with Parkinson's disease are really vulnerable to the negative effects of psychological distress. So increases in anxiety, depression, tremors, motor skill symptoms, and medication may even prove less effective at times. So the good news is there's been a lot of studies with mindfulness, and evidence is demonstrating that mindfulness-based interventions, which is what we just did, is helping reduce psychological distress and improving clinical symptoms. So this other study I thought was interesting. They did a survey of 5,000 patients that have Parkinson's disease, and stress significantly worsened both motor symptoms, especially tremors, and non-motor symptoms. And so I won't go through this completely, but it's interesting to look at the effect of stress on the Parkinson's symptoms. We can look on the left hand on that A here. I don't know if this is a pointer. I don't think it does. So on A, look at the tremors increase when somebody believes or perceives that they're stressed, sleeping problems, depressed mood, and then bradykinesia, I can never say that word, gait and freezing, and dyskinesia. And so, and the other side of that, just feeling time pressure, social stress, those are the kind of stressors that people were responding to. And this is a really messy slide, but what I wanted to show you is the middle part there and just talk about that. But this is a perceived effect of mindfulness to reduce stress in patients with PD. And what I found really interesting is that when you look at that graph there in the middle, C, that's what I really wanted to show you, is the more somebody practiced mindfulness, the better their mood became, less anxious, fewer tremors, less sleep problems, their gait and freezing improved. So it's just several times a day. And I don't mean for you to meditate 20 or 45 minutes, 3 times a day. I'm going to give you some ideas about what you can do to be able to integrate this into your daily activity. So one of the things I think is interesting to think about, like stress hormones when we react to a stressor over time. So this would be an idea of a graph in terms of this, when we react to a stressor, what we want to do is recover really quickly. And of course, if we logically think about that, of course, we want to recover, but a lot of times we don't when we react to a stressor. So what happens is that over a period of time, we lose resiliency, and so we react really quickly. And so the idea behind this is really to get to this place where we are hitting the reset button as quickly as we can, and perhaps even trying to train ourselves not to react to the stressor in the first place, which is not always the easiest thing to do. But really finding ways to recover can be as important as successfully facing stressors in the first place. So there are a lot of physiological benefits of mindfulness meditation. And a couple of those, just pulling from the literature, is lower states of physical arousal. So if you felt a little bit more relaxed during that mindfulness meditation that we did just a moment ago, that's allowing yourself just to kind of calm down and soften. When we talk about kind of relaxing the muscles a little bit, it's really paying attention to be able to soften those and recognize where you're holding tension. Decreasing heart rate, lower stress, calming breathing, and then you're using your oxygen more efficiently when you're breathing with that diaphragmatic breath. reducing cortisol levels, which is a stress hormone, reducing blood pressure, immune function is better, you're improving in improvements in sleep. And those are just a few, but there's a lot of different studies that are looking at the physiological benefits of this. And then psychological benefits of mindful meditation, I mean, increasing your self-awareness. So just practicing some of these things and slowing down to be able to see what you need and what you're thinking about is helpful. So that's allowing you to gain some self-awareness, maybe even where you're holding your muscles more tense than you even realized. So improving your overall emotional well-being, better stress management skills, improving your mood, improving your working memory and fluid intelligence. And some studies are really showing a benefit in decreasing anxiety and depression. So the neurological benefits of mindfulness meditation, there have been many there too, with measurable changes in the gray matter in the brain, and that can be involved in memory and learning and emotion. And so parts of the brain related to attention, sensory processing, again, emotion and stress regulation, empathy, compassion, those are all strengthened with regular practice of mindfulness meditation. And then the key thing really is focusing on controlling the controllables. So I like to think about, and it's kind of reinforcing what Dr. Golubeck just talked about as well, is what are the basic things that we can do to take care of ourselves, and what do we have control over and what we don't have control over. A lot of times when we stay stressed, it's because of things that we're trying to control that we don't have control over. So sometimes asking yourself a really simple question, right? What can I control in this situation? Like pausing for just a second, instead of running around with your hair on fire, right? You can pause and just ask yourself that, and maybe you'll get that answer and be able to calm down. Because the truth is that we can only control what we think, what we say, and what we do, and the way we respond to events that are outside of ourselves. So accepting what you cannot control and really stopping yourself from wasting any energy on anything else. So I'm going to just reinforcing what Dr. Golubeck already spoke about, when we're focusing on consistent self-care, proper sleep, if you can focus on great sleep hygiene, eating cleanly, restorative exercise is tolerated, and Tina's going to talk about that in a little bit, connecting with other people, making sure you're eliminating any toxins and integrating all recovery activities. Those are all helpful in thinking about this baseline, controlling the controllables. So when we're practicing some mindfulness meditation, it really is cultivating 3 core skills, and those are concentration, sensory clarity, and equanimity. And so when we're thinking about concentration in particular, it's really obviously the ability to focus and stabilize one's attention. So we have so many things coming at us all the time, it seems like nowadays. So being able to improve your attention and concentration will be helpful to be able to slow down a little bit and figure out what you really need. And then sensory clarity is the ability to keep track of the components of sensory experience as they arise in various combinations, like moment to moment, right? So what are you feeling? What are you experiencing? We talked about in that mindfulness meditation that we just did, what kind of thoughts are coming your way? What are you thinking about? How's your body feel? Are you able, where do you hold your tension normally? Are you able to kind of soften that a little bit? And if we don't slow down to take that pause to do that, we'll never be able to improve ourselves. And then equanimity, which is one of my favorite words, it's the ability to be with your experience with an attitude of gentle matter-of-factness. So it's just allowing things to be and not overreacting to those. So we want to think about mindful awareness of routine activities. So when we're talking about kind of pulling this together for the day, I think it would be impossible to live our lives in this Western culture to be completely mindful 24/7, but we can kind of couple and kind of pull together some of these things. So practicing bringing our mindful attention to daily activities that are often performed mindlessly is a good way to do it. So we were just talking on the break, like just when you're walking your dog, right? So you could decide to walk a little slower. Maybe your dog wouldn't like that too much, or paying attention to your breath with your cadence, or even paying attention to the bird sounds, whatever it might be out and about when you're outside in particular, which is really healthy for you to be anyway. But maybe even calling attention to maybe when you're brushing your teeth or eating a meal. Sometimes we've practiced this exercise, mindful eating. I just gave that to one of my classes that I teach at UC, and it's eating a raisin, and it takes about 10 or 15 minutes to go through this exercise. Can you imagine one raisin, right? So maybe your next meal, you could just try to slow down and really pay attention to the flavors. Walking, again, at bedtime, maybe a particular routine, maybe just when you're sitting and talking with your significant other or your kids or your spouse, whoever that might be. You can even just do it when you're drinking your 1 cup of coffee that was suggested. So it's just whatever it might be, it's doing it mindfully, having some mindful awareness of these routine activities that we normally do. So for home practice, just some food for thought that you can try. So continue to practice this diaphragmatic breathing. It's a little bit of an art. I think Tina's going to talk a little bit about breath as well. Choosing one routine in your life that you could start. When you talked about from the question and answer session from Dr. Golubich's talk, doing something maybe 3 days a week or 3 recipes over a few month period, whatever it might be, you decide how slowly you need to go at this. If this is completely new to you, this whole concept, and we said, the best way to meditate or do mindfulness would be, 20 minutes twice a day. If you did that in silence a couple days in a row, you would probably say, oh my gosh, Dr. Walker I'm not gonna do this anymore, right? So you gotta start small. So even starting with what I'm suggesting here, like creating a peaceful living environment. So at least in one room, right? So, or leaving a spot in the room, depending on how big of a space you have. Making sure that you just create some spot for you that that you can go to. I think it's fairly challenging, difficult to be in a place where there's a lot of chaos going on or a lot of stuff around, even though you're going to probably mostly do this with your eyes closed. And then establishing a daily meditation or mindfulness practice. One of those things could be, we call habit stacking in my line of work. So it could be like right when you get out of bed, or it could be like as soon as you finish your coffee, or after you exercise, or after you shower, whatever it might be. So you can habit stack it. So instead of, if I would say, oh, the best time to meditate for you, if I predicted that and said, or prescribed that and said it's at 2 p.m., and it's in the middle of your day, you again wouldn't make it a routine. So figuring out what works for you. A lot of suggestions are to do kind of bookend your days. That's what I suggest for patients. And then again, start really small. If this is again brand new to you, I'm going to give you some examples for some apps that are out there. There's a lot on YouTube. There's a lot of information out there, and actually for free, that you don't need to pay for mindfulness meditation any longer. But again, practicing the breath, focusing on one routine activity that you can apply to your life. And again, that's, as we already talked about, like just simply focusing on one thing, choosing something that you can practice during the week. And again, that could be one mindful meal. And simply focusing on knowing what you're doing as you are actually doing it, instead of the multitasking that sometimes that we do. So some resources and further study. So I think you may have already spoken about this. I do a little meditation on Monday mornings, and you can see the website there. That has all our classes and events with integrative medicine. And that's a variety of guided meditations. I just kind of pick something that I want to do for that week, and you can pop on, and you don't have to show yourself. You can show yourself and say hi for a second, but most people don't show their video. And but that's a really nice way to start the week. So additional classes, I put that there, can be found at that same site. There's several books. There's so many books out that are beautiful that talk about mindfulness and meditation. One of the books that has an 8-week plan is that third book there. I use that for a course that I use at UC in a positive psychology class that I teach. And it's great because there's little downloads, audio downloads, and the guy's voice is very nice. So then there's some apps there that you could download as well. Insight Timer, that's my favorite one, and the only reason it's my favorite now, I don't know if anybody else has that, but there's like 140,000 meditations on there, and that might seem overwhelming. They're very well organized, but when practicing some of these things, what's nice is that if you don't like one person's voice, you can go to somebody else, or if you don't like what they're saying, you can just find somebody else, depending on where you are. There's also music on there that you could just listen to kind of keep that kind of calm space. And then there's several other apps that are very popular on there as well. So thank you very much. I'm going to open that up to some questions. Thank you.
So far, no questions, but
Okay.
we're hoping.
Hopefully everyone's awake. And if anybody thinks of questions later, or you need some of the resources, I have my email address on there too. If you want to, please feel free to reach out to me as well.
I have a question about the sensory clarity. Can you expand on that a little bit more?
Sure. So when you're taking that pause and kind of slowing down a little bit, the sensory clarity is that to understand what's really happening in your mind and body. So it's literally gaining clarity over your senses, if that makes sense. So a lot of times, I'll give you one example. So when COVID first hit, I was asked to do this mindful meditation for faculty. And at one point, I was literally doing it 3 times a day, like 3 times a day for 5 days a week, which was a little crazy. But this one particular meditation, it's a body scan exercise where you're not really trying to really soften your muscles, but you're kind of going through each muscle, and I'm guiding somebody through that. And the interesting thing is the more you do those kind of things, you might not even recognize, let's say, like right now, if I could say, like, I'm really focusing on my trapezius muscles, right? What happens is that when you're slowing down, you're resetting, you're doing a little breath, and you're really paying attention to specific muscle groups, you end up gaining, the clarity I gained was that, wow, I could continue to soften. I could continue to soften. Like I thought it was, as soft as I could be, right? But you're sitting there and talking through that, and you can just gain that idea of just really, not even idea, it's really changing yourself physiologically, of really letting loose. And that's the same thing with the sensory clarity with your thoughts, right? A lot of times we don't slow down. We don't think about, maybe we're connecting something and kind of beating ourselves up, or thinking about something that's no longer true or never was true in the first place. So it's really allowing you to create that mental and physical space to be able to gain that clarity. Yeah, good question. Yeah.
I don't think we have any more.
Okay, great. Thank you.